Well, thank you everybody for coming here this afternoon. Today, more than 2.3 million COVID-19 vaccinations have been administered in Saskatchewan. It has gotten us to a point where those 12 and over, we have an 85% fully vaccinated rate. Our entire population is 75% fully vaccinated rate. We have 48% of those 12 and over have their booster shot. That's among the highest in Canada, and likely even more impactful than that is of our Saskatchewan residents aged 60 and over, 75% of them have went out and gotten their booster shot. It puts us in a strong position as we find our way through the Omicron wave. This is good news, as vaccines do reduce the likelihood that people would experience severe outcomes due to COVID. And it's good news because Saskatchewan people have consciously made the choice to go out and get vaccinated in large numbers. Saskatchewan has never had a vaccination mandate per se, but we have had the proof of vaccination or the proof of the negative test requirement in place since the Delta wave that we experienced last fall. This difference from the federal vaccine mandate that is you either get vaccinated or you ultimately lose your job. The requirement that we had in Saskatchewan with the proof of vaccination or the option for the proof of negative test had two goals. One was to convince additional people to go out to make it a priority and go out and get vaccinated, and two was to reduce transmission of COVID. And I would say that it's been very effective on both counts, in particular as with the Delta variant. But now, in light of the Omicron wave that we're facing, it is incumbent for us to adapt, as it's quite obvious that the virus itself has adapted. Omicron transmits among vaccinated and unvaccinated individuals quite freely. Over the past week, for example, we've had 78% of our new cases were in those folks who were fully vaccinated. Many of them have also received their booster dose. I would be an example of that. I received 3 doses. I contracted the Omicron variant. We see today that the Prime Minister, also an individual with 3 doses, has contracted the Omicron variant. So 78% of new cases over the course of the past week were in individuals that would be considered fully vaccinated. As I said earlier, 75% of our population is fully vaccinated. The bottom line of all of this is that vaccines do work, but they are no longer working at preventing transmission in this wave of COVID-19 like they previously did in the Delta wave, at which they were quite effective. And that is why the proof of vaccination or the proof of negative test requirement that we have in Saskatchewan will very soon come to an end. Public health experts, including our Chief Medical Health Officer, Dr. Shahab, has signaled that Saskatchewan is near the peak of the Omicron wave and that we will see the pressure reduced on our healthcare system in the weeks to come. Day in and day out, for almost 2 years now, Saskatchewan people have done what we and health professionals have asked them to do. They have followed all of the public health measures when they are implemented and when they have been necessary. They have gone out and gotten vaccinated. 75% of our entire population, 85% of those that are eligible have went out and gotten vaccinated. They are utilizing rapid tests, and I would say that in Saskatchewan we are utilizing the supply of rapid tests that we have unlike anywhere else in Canada, and that is a good thing. Saskatchewan people are also aware of and they are utilizing, when it is necessary, any early intervention treatments, such as monoclonal antibodies, such as ultimately Paxlovid, that is now available and being administered here now in the province. So now, and our caucus MLAs are hearing this from the people that they are talking to across the province and the people that they ultimately represent, and people are asking their government for a return to normal, a removal of public health restrictions, and we most certainly are looking at how we can do that in the weeks ahead here in Saskatchewan. And now I think it is, in fairness, it is time for us as a government to do what Saskatchewan people are asking for. Public health will have more to say on how we are going to continue our steps towards living with COVID in the days ahead. As I understand, they will make themselves available later this week. But now I would take any questions if there are any.
Premier, we saw the desecration of the National War Memorial in Ottawa over the weekend. There was Nazi imagery. There was more, really, frankly, bad imagery out there. You kind of threw your support behind the people of this convoy on the weekend, so do you condemn those actions specifically that were taken in Ottawa on Saturday?
Yeah, absolutely. And the individuals that have done these actions, that whether it's dancing on the tomb of the unknown soldier, whether it's putting flags and such on Terry Fox, a very icon of this nation, whether it's harassing people in any business, in particular people that might be working in a homeless shelter. These people should be held accountable. If the acts that they have performed are illegal, I would hope that the RCMP, or the OPP in this case, or whoever the law enforcement agency is, would ultimately hold these individuals accountable. And I would go a step further to say that what these individuals are doing, they owe Canadians an apology. It's absolutely despicable that we see people doing this. It takes away from the broader message that the vast majority of law-abiding folks that are participating in whether it be the Ottawa rally, this rally we saw here in Regina, or numerous other communities across the province as well. It takes away from the message that they are conveying is that vaccine mandates are not working, vaccine mandates are not necessary, and they're something they'd like the federal government to remove. Ours is very different. In Saskatchewan, we have the proof of negative test option, and we've signaled that we will be ultimately removing that in the days ahead. We've seen these type of actions by individuals at previous gatherings at various times. If we look back in history, and we should always remember that when an individual performs a despicable act, like we are seeing here, or like, quite frankly, when we saw a number of people in front of this building having their voices heard on a very important topic. We saw one individual ultimately spray paint over the names of soldiers that have given their life to this country and this province on our war memorial here in Regina. Also a despicable act, also an individual that should ultimately be held accountable for that act. But it is in no way should detract from the message that was being brought forward and heard on that particular day, and the same holds true today.
Actions of the bad people, but what about the silence and indifference of the good people, including yourself, because many are not commenting on the actions or standing up against the actions unless they're prompted by the media through questions. So what about the silence and indifference that we're seeing from the standardized?
Anyone, when they see someone that's doing something that is discriminatory, whether it is something that ultimately is a despicable act like what we have been discussing here today, whether and if it's an illegal act, they should step in. And I won't ascertain between good and bad people, but most certainly we should step in and we should stop some of the actions that we have ultimately seen. We've all seen them on the news. But us also as individuals, and you ultimately as the media, we should always be separating out individual actions from the broader message that people want to bring. And we see a number of those messages on various topics that come and arrive at the front of this building. We saw a large one this weekend with the what started with truckers, but I can assure you that in addition to truckers out front of this building this weekend, there was teachers, there was nurses, there was other healthcare workers, there was welders, there was frontline workers in our retail businesses from across the province, and that's why we communicated with them our support for that broader initiative, and our support, and what ultimately we are hearing from Saskatchewan people is that as we find our way to living with COVID, part of that is going to be reducing the public health measures that we have in place, and we're taking a very bold but responsible view as to when we're going to be able to do that.
We've seen a few doctors in Saskatchewan now, Dr. Alex Wong and Saskatchewan Medical Association, take issue with some of the things you said in the letter that you published on Saturday, specifically with your comments on vaccines not preventing infection or transmission. So I guess I'm wondering on what basis you're making those claims, and when these experts are disagreeing with you, and do you think you made a mistake in saying that? And if you did, are you willing to correct the information you put out there?
I think what I'm speaking to is the data that we have in front of us. And what the data is saying ultimately is that the infection rate that we have, the new cases that we have in this province are roughly about the same in vaccinated and unvaccinated people here in Saskatchewan. And so it is ultimately not stopping transmission by the data that we have in front of us. And we're being very transparent with Saskatchewan people. Anyone can look at what that data is and make their own assertions, but that is the fact. The number of people that are getting COVID is roughly the same proportion as the number of people that are vaccinated here in the province. When it comes to severe outcomes, vaccination greatly reduces your chance of having a severe outcome and ultimately possibly ending up in a hospital bed in Saskatchewan. And so I would say again today, like I have virtually every other time I've made myself available, if you haven't been vaccinated yet, you should consider it. It will reduce the symptoms that you may encounter should you contract Omicron. So as we look ahead, understanding that data is there, that is part of the precipitous behind why we look at the proof of vaccination, proof of negative test policy here in Saskatchewan, which is different than the federal policy, markedly different than the federal policy. It has run its course. It has increased our vaccination rates. It was effective at reducing transmission during the Delta wave. However, it doesn't appear to be reducing transmission with respect to the Omicron wave that we have here today. And for anyone to say different is quite frankly just not the case.
Doctors and experts, they probably have more context than you and I, given their background in this. So if they're saying that that's incorrect, that it actually does help with stopping transmission, shouldn't, I guess, they be deferred to?
I just looking at the data, and what the data tells us is actually we have a few more people that are vaccinated proportionally that have Omicron here today. I'm fully vaccinated plus my booster shot. I still got Omicron. The Prime Minister, fully vaccinated plus his booster shot. He still got Omicron. For every 100 people in Saskatchewan over the course of the past week that got Omicron, 78 of them were vaccinated. And we have about 75% of our overall population is vaccinated. And so it's roughly about the same, in fact, a few more. I think we need to identify with the facts that are before us, regardless of what we do. If we're a physician or a reporter, we need to identify the facts before us say that vaccinations are not reducing the spread of Omicron, very effective with Delta, but are not reducing the spread of Omicron, but are and continue to reduce the severe outcomes. And so we should still get vaccinated, and I've been an advocate of that from day one. But to report anything outside of what the facts are in Saskatchewan, quite frankly, is irresponsible.
Our reporters understand that, yes, vaccines aren't perfect. There are going to be some breakthrough cases, especially with Omicron, as you alluded to in your opening statement. But there has been studies that show from various countries, including the CDC in America, that vaccines do work up to 60% against contracting the Omicron variant. So what data or study are you basing your information on? Because yes, there are breakthrough cases, but to completely say that it breaks transmission completely, it seems a little misleading to the public.
Well, no, I mean, I don't know how much more clear I can be. I base it on last week's data in Saskatchewan. We have more people that are like our proportion of people that are getting Omicron in Saskatchewan is slightly higher than the proportion of people that are vaccinated. I don't know how else to say that any more clear. And so that's what we're seeing here in Saskatchewan. But as I say, it's still important because it's reducing the severe outcomes that we are seeing with Omicron. We have, I believe as of today, 153 the people that are in the hospital with Omicron or due to Omicron here today. Our hospitalization system has gone up slightly in the past week, and we're watching that quite closely. But and also watching ultimately our absenteeism in our facilities, which has remained relatively similar to last week. And so we are finding our way through this Omicron wave. We have tools available that Saskatchewan people are availing themselves to. Some of those tools are not available in other areas of Canada, and we're thankful that we have them here in Saskatchewan. And what we're saying here today, what I said a number of times last week, is we are going to continually assess the tools that we have, including public health measures, and those that are effective in reducing spread and effective in keeping people out of hospital. We're going to continue to make those available. And those that may have run its course, like the proof of vaccination policy, proof of negative test policy, we're going to look at ultimately removing that. And that's what we're hearing from Saskatchewan people across the board. Government MLAs are hearing that across this province.
Your website, your government warns of misinformation circulating around vaccines and instructs the public to seek science-based sources. So why are you departing from that government message, and how come Dr. Shahab is not in front of us here today, as I have requested an interview with him today, and how come he is not telling us what you are telling us today?
Dr. Shahab will be out, my understanding will be later this week. I had a briefing with Dr. Shahab this morning where we discussed, among many things, what we're discussing here today. And like I said, there's numerous, been numerous comments and various things that have been referenced, whether it be modeling, which is really a number of assumptions that go into predicting what potential outcomes could be. And we had that discussion last week with respect to modeling around excess fatalities due to COVID here in Saskatchewan. And, you can bring all of the numbers together, but the fact remains that, and by the author's own admission, I think it started at 7,000 excess fatalities, was reduced on a global interview to 4,000 to 5,000, and then by a tweet to somewhere in the 3,200 range. Modeling is just that. You change some of the assumption, whether it's COVID or climate modeling, quite frankly. If you change the assumptions going into the model, you can wildly change ultimately what the outcome is of that modeling. What we have said is, in the case of modeling, we look at that as one of the tools ultimately that we would utilize in the decision-making process here in Saskatchewan. But we're also going to look at the data. And what I'm saying here today is the data shows that in the case of the Omicron wave, which is unlike the Delta wave, that vaccination does not appear to be preventing contracting Omicron. That was the case with me. But it most certainly does continue to be effective at reducing those severe outcomes. Also the case with me.
Specifically, are you removing the proof of vaccination requirement? Like what date specifically?
I don't have the date here, but it's under consideration, and there's a number of factors that are going into that decision.
Which will everything go when you remove that? Like masks, all that stuff?
No, I think we haven't made that decision yet, but we have two public health orders, indoor mandatory masking, as well as the proof of vaccination, proof of negative test policy. Both have been renewed to the end of February, February 28th. I think you could look for the proof of vaccination, the date for the termination of the proof of vaccination policy to be that or to be pulled forward sometime between now and then.
How much of your government's response to COVID has been based on your observations as opposed to recommendations from experts?
We're in constant discussion, as is our chief medical health officer, Dr. Shahab, with medical experts, with scientific experts across this province and around the world, as well as mixing those conversations with data ultimately that is available in other provinces and in other areas of the world, and that data has been different depending on which variant each province or / country is ultimately working their way through. We had a significant Delta wave in Saskatchewan last fall, where we had much lower numbers than we're experiencing today, and a very challenging situation when it comes to our hospitalization rate and ultimately our ICU rate that we experienced during that Delta wave. Omicron is very different. We're at a stage today where we have more people vaccinated in Saskatchewan than we ever have before, and we admittedly have some of the highest daily case numbers that we have ever experienced before here in the province as well. What I would say is that as we look ahead, and what I'm seeing in communities and what other MLAs are seeing, is Saskatchewan people, after 2 years of managing their way through various COVID waves, understand COVID quite well. and they understand the tools that are effective, and they incorporate those tools into their daily risk assessment that each individual ultimately is making. And we have some tools, yes, available here, such as access to rapid tests that are not near as accessible in other areas of Canada, and Saskatchewan people are utilizing that tool, and a credit to them. They are utilizing all of the tools ultimately that we have available here in Saskatchewan, and I think in many ways they are fully prepared to move forward through not only the next number of weeks, but the next period of time, utilizing those tools to do their own personal risk assessment and to continue to keep themselves and those around them as safe as we can through the Omicron wave. Now, should things change and the environment change, we would have to adapt to whatever that looks like. Should a variant show up that has outcomes much more similar to Delta, then we would have to have a very different discussion. But with the Omicron variant that we are facing, we are seeing some public health policies that have ran their course and served us well, but their time has come for review.
I think there's 300, as of today, 363 people in hospital, 42 in ICU. You referenced earlier the fact that Dr. Schwab has indicated that we're almost hitting our peak with Omicron. I don't know, are you referencing his general timeline of that 4-week peak, or have you heard him say that? Because from what I have heard in the past week or so of Schwab speaking, I haven't heard him say that we're nearing our peak, and those hospitalization numbers are climbing. So I guess I'm just wondering where you're getting this information that we are nearing our peak of Omicron, and that the hospitalizations aren't going to rise to a point where they were with Delta.
Yeah, I think Dr. Schwab has indicated that the last time he was out, I think I specifically heard him, and in our briefing this morning, that we have neared or actually hit our peak with respect to case numbers. And our case numbers, if they haven't started falling already, should most certainly start falling like they have in virtually every other jurisdiction around the world. And as we know, hospitalizations will continue for increasing for a number of days after that. And so very much, very closely, we were watching our hospitalization numbers, how they're impacting the entire healthcare system, along with our absentee numbers, and watching the rate of what that increase in hospitalization is for the next number of days, and ultimately when it ultimately should peak. So there's a number of factors that are being watched by Dr. Shahab, as well as a number of others in the Saskatchewan Health Authority, as well as the Ministry of Health, and what we have seen over the course of the past number of weeks as well is an increase in the percentage of incidental rates in our hospitalization, which would match the fact that we have higher transmission rates, higher daily case counts in our communities, and more people that are presenting themselves to a hospital for something that may be quite unrelated to COVID, are finding out on admission that they ultimately do have COVID as well. Those people would be in the hospital regardless, but the fact that they do have COVID is added resources that are required, as they has some infection protocols for the staff ultimately that are working with them. And at the end of the day, where we are with hospitalizations due to COVID, it's 153 of the 363 that are in hospital. I don't know what our incidental rate was during the Delta wave, but I would venture a guess that our hospitalizations due to COVID during the Delta wave were much, much higher than what we're seeing in Omicron.
Premier, I'm wondering if you have any thoughts on the child who passed away of COVID over the weekend. If you have a message to that family.
I don't know the circumstances behind that particular incident, nor would I comment on the circumstances with respect to any individual incident with COVID-19 here in the province. But what I would say to this family and to all families that have experienced loss to COVID-19 over the course of the past couple of years is most certainly our thoughts and the government's thoughts. All of the individual members of the government's thoughts are with you. This has been a challenging time with some very, very significant outcomes for families across Saskatchewan, and not all of them have been positive. Some of them have, I know families personally that have lost a loved one throughout the course of the last 2 years. I know a number of families, and my heart aches for them in particular. And I think in fairness, people across this province have been dealing with this pandemic over the course of the past 20 months, like people around the world have been dealing with this pandemic over the course of the past 20 months in great form. But it does not discount the fact that we have lost people to COVID-19, like other provinces, like other countries, like families all around the world.
I'm also curious about your tweet today. You chose this morning to post about the Angus Reid research.
Sure.
I'm wondering why you chose to do that, maybe versus calling out the protesters in Ottawa like you have here today. Why was that a priority for you?
Well, I think what Angus Reid is picking up on is a shifting public sentiment. And this is what we're hearing in our constituency offices. This is what I'm hearing in my constituency office, and this is what I'm hearing in the correspondence to the Premier's office as well, which is much, much larger than what would be considered normal. And what we are seeing, and I think over the course of the past week or 10 days since the last Angus Reid poll, there's been a marked shift in people across Canada that are now looking at how do we live with COVID, and part of that is ultimately the removal of some of the measures that have been in place and continue to be in place yet today. That public sentiment shift is happening. We've heard it firsthand across this province, and I've met with government MLAs on numerous occasions recently. And that is precisely what they're hearing in their constituencies as well. Saskatchewan people have been working their way through multiple waves of this pandemic for close to 2 years now. They are well versed on the effectiveness of the tools that are available to them. They're utilizing those tools that are effective, and they're prepared now for government to begin to take some steps back in removing the measures that are in place, and ultimately, allowing people to really get back to what is a much more normal course of life.
I'm wondering what is more of a priority for you, calling out the actions of those protesters in Ottawa or pushing the cause of this protest?
Well, and what was the first part of the question? What is more important?
To you.
It's all important. It's all important. The actions of some individuals should be called out. I've done that here today, and most certainly they should be held accountable. The acts that we're seeing are nothing short of, as I said, deplorable. But there are many individuals, and we saw many of them here in Regina, that want their voice heard with respect to, in this case, vaccine mandates, but I think it could extend, and it starts with truckers, but it goes far beyond truckers. It extends to a number of the public health measures that we have in place. Some remain effective. Some have likely run their course, as I've indicated here today, and we're reassessing which is which, and ultimately with a goal. And I think, in fairness, this is the goal of every government, is to remove the public health measures that are in place at some point in time. What we're saying is on the proof of vaccination, proof of negative test policy, we're going to be looking at doing that sooner rather than later.
I'm just trying to understand the urgency of removing these requirements. We've seen places like BC go, maybe not till June we'll remove them. I think doctors understand that removing them will happen at some point, but they're not saying necessarily now or in the near future, like you mentioned. So why this urgency from your perspective to remove these quickly or in the near future, like you say?
Well, I think is one of the reasons is this is what people want. We see that in the Angus Reid poll, the shift. We're hearing that in our constituency offices, and this is a government that ultimately continues to represent the people that we serve. Second, we have a high vaccination rate here in Saskatchewan. When you look around the world, we have 85% of those that are eligible are vaccinated. 75% of our total population is fully vaccinated here in Saskatchewan. That's a high number when you place it against virtually any of the U.S. states or many other areas, countries around the world. So Saskatchewan people have most certainly done what we have asked, and now they are asking to move forward with their life in a much more normal fashion. And this is a government that is doing everything we can to provide the tools that are effective: rapid tests, monoclonals, Paxlovid, all of those tools that are effective at reducing the severe outcomes of the Omicron wave, and providing the opportunity for our kids to remain in school, of which we made a change last week around close contact isolation, which the parents that I had the opportunity to converse with over the course of the weekend were very appreciative, some of them educators themselves. So ultimately, our goal is to move, and move in an expedient fashion as we can, but also to be responsible with the actions that we are taking, and ensuring that Saskatchewan people continue to have access to the tools that are keeping them safe, and they do. And we must also recognize that, in the case of negative tests, not everywhere in Canada has access like we do in Saskatchewan. We shouldn't take that for granted.
We have time for a couple
Many
last questions.
epidemiologists, they do say that, maybe we're at a point where risks could be outweighing the benefits of COVID-19 restrictions. On top of that, we're hearing from you that vaccination is not reducing transmission. So why do we still then have this proof of vaccination system in place? Why not get rid of it today?
We will get rid of it in very short order, unless the environment changes. Government hasn't made that decision as of yet. However, we're going to be in very short order. That's my answer. I don't have another answer.
What's the science that's leading us to not get rid of it today or this week?
We just haven't made that decision yet as a government. But we've tried to be transparent through the letter to the Saskatchewan people, of which many, I think, people in Saskatchewan had the opportunity to read, and ultimately we will be moving on the removal of that policy as soon as we make the decision.
So then why do we have to live with it then? Just because you guys are slow to remove it? I'm just not understanding why we still have it in place if this government is saying that vaccines aren't helping with transmission. Maybe it doesn't benefit the public anymore, then why do we still have it in place? I'm just kind of confused on why we have to live with this.
Well, as we talked about earlier, there's a number of factors that go into all of these decisions around whether there's increased public health measures or whether there's a reduction in public health measures. We talk about, total hospitalizations, what we have in the system, which is up slightly from last week, but we still have capacity within our healthcare system. What our absenteeism rate is, whether or not we have peaked on our numbers, ultimately, because as those numbers start to decline, some of the lagging factors then follow after that. What is the trajectory of our hospitalization rate? Is it starting to narrow? Is it still increasing? But is it starting to increase by less each and every day? And ultimately, what is the ratio of incidental hospitalizations, which has been increasing as our hospitalizations increase, versus our folks that are unfortunately in hospital due to COVID, of which we have 153 here today. So all of that is coming into the conversations that the Minister of Health is having with Dr. Shahab. Where we stand today is the public health orders are set to expire on February the 28th, and what I'm saying is if we are able to pull forward the proof of vaccination, proof of negative test policy to expire at an earlier date, we are looking at whether or not we can make that decision in the days ahead.
For the last 6 months, you've been telling people, the only way through this is to get vaccinated, everybody get vaccinated. But what you're saying now is, number one, that the vaccination won't stop you from getting COVID, which I guess in some corners is debatable. And then you're also telling people this is going to end soon. So aren't you kind of going against all the work that you've done the last 6 months?
So first of all, it's not debatable. When you look at the data here in Saskatchewan, the data is the data, and so anyone can look at it, and I would encourage all Saskatchewan residents to have a look at the data with respect to the cases of Omicron that we have, whether you're vaccinated or unvaccinated, roughly mirror the levels of vaccination that we have here in Saskatchewan. That being said, vaccinations are still most certainly reduce the severe outcomes of the Omicron variant. In the case of Delta, it reduced both the transmission and the hospitalization. In the case of Omicron, it still significantly reduces severe outcomes, will reduce your risk of ending up in hospital, which has always been the goal of the government, is to preserve the hospital capacity that we ultimately have. So that's where we are today. That's what the data tells us. We've said for some period of time now, we are being driven by the data that we have before us, the data that we're seeing in other areas of Canada and around the world. And that's what it's telling us today, and it is what it is.
You said weeks, and then you've also said in the days ahead we might, remove this. What should we tell people? There's people on both sides of this issue.
What I guess with respect to the removing the proof of vaccine, proof of negative test policy, right now it is extended out as the mandatory masking order is out to the end of February. What we're looking at specifically right now in the days ahead is can we set a date to pull the proof of vaccination, proof of negative test forward? We may not be able to, but we most certainly are going to be looking at whether or not we can do that. It's a policy that, as I said at the outset, was put in place to increase our vaccination rates here in the province. It achieved that. It was put in place when we were managing our way through a Delta wave here in Saskatchewan, and it was put in place to reduce transmission. It most certainly did achieve that during the Delta wave, but it appears to not be achieving that during the Omicron wave. And so it is a policy that I think when you look at the parameters and the reasoning as to why it was implemented, it has really run its course, and it's most certainly time in the days ahead for the government to revisit that as to can we pull that termination date of that policy forward from February 28th. And Dr. Shahal
Planning in the days ahead. Planning in the days ahead for a date before that. February
as soon as
28th.
if we're able to decide on that, you'll be the first to know.
Are you saying it won't be extended past the 28th?
That would be the goal now, is to bring that date forward as opposed to even leaving it at the 28th. That being said, as I said, everything that I'm saying is precursed by the fact if our environment changes with COVID, we may have to revisit some of what we're discussing here today. But if we are finding our way through the Omicron wave, it is our goal to pull that date forward on the proof of vaccine, proof of negative test policy, and ultimately then have a discussion around any remaining public health measures that are in place. Listen, Saskatchewan people, they can be very proud of the effort that they are making. They are doing things in this province that I'm not even sure if all Canadians are doing it to the degree that we are as people in Saskatchewan. They're doing their risk assessments. They are utilizing their rapid tests when they feel it's necessary. The vast majority have went out and gotten not one, not two, but even 3 shots. All of this is helping reduce the severe outcomes, reduce hospitalizations. We're seeing continued increased uptake with respect to monoclonal antibodies, as well as the new the Pfizer Paxlovid pill that is available. Also, I think will prove to be quite effective at keeping people out of hospital. Saskatchewan people are doing a remarkable job, and they should be commended on the effort that they're making as individuals, as having a collective success here in Saskatchewan, and I think when you compare where we are in this province to other provinces, that speaks for itself.
Is the government still relying on the proof of vaccination system to reduce transmission?
Are we still relying on it to reduce transmission?
Of COVID-19?
I think what I've said today is it's not. When you look at the data when we look at the data that we have, it appears that it is not reducing transmission of the Omicron variant. We'll see in the days ahead, but that's what it appears like today. And so ultimately, that's why we are revisiting that decision. The government just doesn't snap their fingers and make decisions overnight. There's a number of people that are at that table providing input ultimately for when and where the government would make a decision like this. But what we've indicated, and with every effort to be transparent with people and understanding what the Saskatchewan people are asking us for in our constituency offices across the province. And this is a public sentiment that is turning and turning quickly, and I would say that the results that we see in the Angus Reid poll are already to some degree outdated as that sentiment continues to turn, that people are prepared to move forward. They understand that COVID is not going away. We do need to learn to live with COVID like we do other infectious diseases, and that is what we are taking a some would say a bold but measured and responsible approach to in the days ahead. What about Dr. Shahab?
What is Dr.
Shahab think of it? He'd be at that table. What has he told you?
He most certainly, Dr. Shahab, will be out later this week. I think he's going to have some...
Right, but what has he told you, Premier?
On which?
About removing this, I'm
not going to speak for Dr. Shahab. You'll have to speak.
You haven't had conversations with him?
Yeah, absolutely, as recently as this morning on a number of topics, including this. And you will have, I'm not going to speak for our Chief Medical Health Officer. He is out here weekly, virtually, and you have every opportunity to ask him those questions. I think he was out here actually last week to answer questions just such as that. I don't believe that particular question was answered. I would, however, say, Dr. Shahab has been remarkable, has provided remarkable guidance throughout the pandemic. We've had multiple discussions in this room over the course of the last number of months with respect to, why is something a recommendation versus a public health order? And what we are seeing across Saskatchewan is Saskatchewan people are listening to the advice that Dr. Shahab provides, and they are conducting themselves in a very responsible action. I see it when I, go to other communities over the course of the weekend, or when I go back into my own home community over the course of the weekend. And I've never been prouder to be where I am from, and that is ultimately because of what I see Saskatchewan people doing day in, day out. Talked to a number of parents as recently as this weekend. I got to the hockey arena, which was I haven't been to this year. And there's a number of parents that ultimately are quite thankful that their children are able to this week participate in extracurricular sports, even if they've been identified as a close contact. I was also reassuring to hear that each of those parents were also had a regular testing regime, in particular in place when one of their children or them themselves may have come in contact with someone with the Omicron variant. And so Saskatchewan people are utilizing the tools, and we can be collectively proud of one another for the effort and the initiatives that we're taking.
One more. Just we can agree on the fact that getting vaccinated reduces severe outcomes. So obviously that's one reason to encourage vaccination. I crunched the numbers last week. I think like 12,000 people in the last month received their second dose, 12 and above. It's 15,000 a month before. That has dropped from the first month after the proof of vaccine mandate was put in. I think it was around like 50,000 that first month. So is that rate slowed down enough, you think, for it to say that it's run its course? I mean, if we're still getting 10,000 people a month getting their second dose, if a vaccine mandate can encourage that number to keep going up, around 85%, 12 and over, fully vaccinated. Obviously 100% is ideal, but over 85 would be beneficial for everyone. So has that rate slowed down enough for you to consider it having run its course?
People should continue, and I've said this time and time again, is to, if you haven't gone out and got your first, second, or even your third shot, if you're eligible, you should consider it. All we talked about here today with respect to the transmissibility of Omicron, it may not be having as large impact at all, or it appears, on the transmissibility of the Omicron variant. As I said, I have 3 shots and I got it, the Prime Minister has gotten it, but it most certainly is still quite effective at reducing those severe outcomes. And that's reason enough to consider going out and getting your 1, 2, 3 shots. But I think we also have to come to the conclusion as we find our way through the Omicron wave that not everyone is going to get vaccinated. And we have put in place policies that have encouraged people, yes, to go out and get vaccinated, the proof of vaccination, proof of negative test among those. But if we're truly going to move forward in not only the weeks and months ahead, but the years ahead, and perform at our very best as communities and ultimately as a province, and we have so much opportunity that lies before us. We need to move away from policies such as this. We hear that in our constituency office at an increasing rate as the days go by, which I think the most recent poll has indicated that public perception is changing. People are understanding that COVID is here to stay, like many other infectious diseases that we have cycle through our community on an annual basis. And we need to make the tools available, which we are, to Saskatchewan people that will keep them safe. But we also need to take every effort to get our lives back to as near normal as we possibly can, and those are the discussions that are the priority of the government today.
Thank you.
Thank you.
Thank you.